In our last talk, we talked about kind of the basic structural elements, boundaries, time, group size, alliance, things that make group psychotherapy effective that neophyte, newer group therapists can kind of pay attention to. I kind of want to take it to the next kind of stage of developmental thinking and talk a little bit what might be called advancing skills in group psychotherapy. Lise Motherwell and Joe Shea kind of highlighted some of the kind of intellectual and emotional trials of working to advance your group skills. So I think I'll share this quote to start. In this morass of complexity and high stress, not dissimilar from individual therapy, but amplified by the number of people in the room, why then do we become and remain group psychotherapists? For us, working with people who begin as strangers and who become intimate partners in learning about themselves and others is compelling, challenging, and often extremely moving. As leaders, we feel effectively engaged and intellectually and emotionally stirred by our patients' courage, perseverance, and willingness to risk. This encourages us to risk the possibility of exposure and also the possibility of self-knowledge and self-growth. To engage with others in such a difficult but rewarding process gives us hope and reinforces what we know about community and intimacy, that through respectful and positive attachments, we become more resilient, empathetic, sympathetic to the pain and needs of others. Now, group leadership requires us to be emotionally open, yet appropriately contained, boundaried, and reflective as leaders. We must be able to think and feel and be ready to respond at a moment's notice. We wrestle to make meaning with the concrete and the symbolic levels of language, subtle body movements, and our own internal dialogues. We need to listen with many ears to accurately hear what is literally being said, and behind the masked affects, cognitive absurdities, kind of disguised needs, requests, and tests from our membership, we need to listen to hear the larger undercurrents, the stirrings of the group as a whole, the movement of the group as it cycles through a cacophony to a harmony and back again, from crescendos to ballads to blues to passionate duets to choral rounds. Part of the challenge in deepening our understanding of group process includes recognizing the lyricism below the single note of any group moment. The newer leader will also often focus on the basics of managing structure, facilitating engagement, building alliances, and most members will grow and benefit from attention to these details of group psychotherapy. As the leader advances, they will try to acquire and utilize additional skills that kind of maximize the depth and breadth of the therapeutic change process, while at the same time preventing member or group as a whole kind of deterioration or stagnation. Barlow highlighted, and I bring this up quite a bit, the unique multiple competencies needed for group leadership. Beyond the foundational competencies, which we covered in the lecture portion of this class, that include clinical theory, research finding, ethics, multiculturalism, we also need functional competencies to deeply understand the uniqueness of our members and groups. These skills would include recognize and managing the multiple transferences in the group, including individual and collective perceptions of the leader, of individual members towards each other, and of the group as a whole. A next phase might be identifying and working with subgroup and group as a whole dynamics, uncovering and identifying overarching themes and what might seem like a discordant or chaotic communications within a group. Additionally, an advancing leader tries to balance the needs and goals of individual members with that of the whole group as an organism. As we move along, we try to become more and more accurate in assessing clients' progress. And I think there's a reflective process and openness, a kind of a lessening of defensiveness as we begin to more deeply examine what may have we missed in the previous group, what may be beneficial in the next group, what biases created us to act or not to act in certain ways in our role as leader. So let's look behind the curtain here. What's happening below the content, beyond the content of conversations in group. This is one of my favorite quotes by Nina Brown about group process. It's very hard to define what group process is, and I think Nina does as well of a job as anyone with this quote. Process is the here and now experience in the group that describes how the group is functioning, the quality of the relationships between members and with the leader, the emotional experiences and reactions of the group, and the group's strongest desires and fears. So that's many things to attune to here simultaneously. Relationships, the emotional experience, clients' desires and fears, both individual members, subgroups, dyadic relationships, group as a whole. You'll commonly hear the idea that process and content are separate, and they're separate. They can have some overlapping things. But I think to become a effective group leader, as Yalom and Les stress, process must be contrasted with content. The here and now of the group may give insights into the then and there of our client's past, and vice versa. Group themes often flow as a process, not as overt communications. A particularly sensitive leadership task is to know when and how to connect those often unconscious processes and themes to here and now content. As leaders, we're looking to accurately identify our clients' patterns and repetitions of thoughts, feelings, behavior, and to help them build more awareness and choice in their responses to interpersonal relations, and to not rely upon just automatic, unconscious, non-mindful reactivity. Group members may apparently be discussing a certain topic, but underneath the surface may be arousing. The unconscious or procedural processes occurring in our groups and in our group's members can have a private logic, and one of our tasks is to help this logic be revealed, understood, and integrative through our own intuitive, associative, and empathetic processes. For example, if a patient relates a story of feeling misunderstood, the leader could wonder whether the client is having a similar experience in the current group. What may have occurred in the group to unlock this memory? What might be the member's current wish or need or fear? Asking aloud to oneself the question, what is the telling of this story serving for this member or potentially serving for the group? Can offer clues about hidden motivation, affects, and needs. Similarly, if a member shares a long narrative about anger with or love of a teacher, the therapist might explore whether this is an indirect communication about the patient's feelings towards the therapist. A then and there story or memory reported in the present may offer insight to the person's experience currently in the group or about the current group dynamics. Helping members link their past and present will assist their future journeys. It is important to note that while exploring a member's or a whole group's process may not be the central focus of some group methods, say psychoeducation or CBT, nonetheless, interviewing at the process level helps the group and the members move through potential blocks. It will heighten member engagement and increase positive outcome. When a group is stagnating, bringing the here and now, people's experience into the moment, into discussion, almost always unlocks the energy for group to get re-stimulated and re-engaged. I think the in vivo aspects of group, the practicing aspects, the rehearsing new behavior aspects of group allows for our members communication patterns, coping strategies, and relational styles to be adapted and moved. I think prior to this, you're kind of looking for the enactment of your group members, and that their coping patterns, communications patterns will often be revealed. This is kind of the idea in many psychodynamic, more passive, obscure kind of leadership, that members will more kind of show who they are and how they are. And then once you see this and can have discussions about it, members can try new ways of being with one another. New responses that may initially be practiced inside the group circle increase listening skills, empathetic skills, vulnerability skills, will eventually extend out into our group members and our group members' lives. So let's talk some about working with Transference as a group psychotherapist. Group psychotherapy has been empirically shown to highlight individuals' central relational themes or transferences. This recent research by Kivlingen really supports the long-held clinical theoretical notion that in many ways group is a microcosm that reflects the individual's outside life, and particularly the individual's relational approaches and kind of social attribution processes. How do they make sense of what's going on in their interactions behind them? How do they understand social communication? In group, people will put into language and report how they feel other people's relationships are, talk about other people's motivations, other people's strategies, and this will kind of reveal the internal world of the client. Simply put, I think, transference is a process when members superimpose feelings and understandings from their past inaccurately or not completely accurately, or at least through their filter, into the current situation. Transference as a clinical phenomena was of course discovered by Freud, but importantly it has been studied and validated empirically by social psychologists, by group researchers, as a kind of ubiquitous, always occurring social cognitive process by which people economically and expediently use their kind of internalized self-other experiences as a template to make sense of the new occurring social experiences and thus create meaning from what is occurring in the moment. The identification and analysis of transference provides opportunities, I think, to build stronger alliances, increase a reality orientation, highlight potentially patterns of cognition, affects, interpersonal relatedness, and resultant behaviors that may be limiting or may be effective. Janet Malcolm kind of reminds us about the complexity of transference work and the arduousness of it. She says, the concept of transference at once destroys faith in personal relations and explains why they are tragic. We cannot know each other, but we must grope around for each other through a dense thicket of absent others. Generally, we are desperately looking for our past in our present relationships in some way, and even when they are not there, we will see the past in the present. Analyzing transference, exploring how we view others as if they were important historical figures rather than who they really are, is intricate enough when done in a therapeutic dyad. This work becomes much more complicated and more richer when there's multiple transferences occurring simultaneously. Transference work is generally seen as best occurring more in the middle or working phases of a group. I think trying to bring this in too soon when people are just getting to know each other will kind of disrupt the trust and safety in these earliest phases. So let's talk about the different kinds of transferences that occur in group. This transference towards the leaders. Feelings and behaviors towards the group leader can take a variety of flavors, from complete compliance to unrealistic adoration, through complete loathing, fear, and unyielding rebellion. I have seen all of these. In the interpersonal sphere of group, reality clashes with projections. Sorting out transference distortions from realistic perceptions will always be partial, but a vital and beneficial exploration. Sometimes a member, a subgroup, or the entire group will have projections or transference reactions towards the leader that can include feelings and ideas that they've had previously towards a parent, sibling, partner, or another significant person in their lives. While transference-based experiences of the leader are wide-ranging and idiosyncratic, typical perceptions range along such dimensions as seeing the group leader as potentially ideal or all-knowing to incompetent and completely ineffective. Some people will see the leader as withholding and overly restrained, and other kind of overly emotional and impulsive. Some will see their leader as either erotic and flirtatious, and others may see them as prudish and inhibited. You can continue this on along the spectrum where people may find the group leader to be trustworthy and dependable, or manipulative and exploitive. People will find the leader open and friendly, or rejecting and dismissive, and you will have all of these views of the leader happening simultaneously within the same group. As a group leader, it is important not to get defensive in light of these negative transferences, and just as important, not to get elevated or grandiose by the idealizing projections that come at group leaders' direction. While there may be a kernel of reality in them, generally transference reactions towards the leaders may say more about the patients than they're saying about the therapist. And further, it is important to remember that transference distortions aimed at us as leaders in the group also are likely directed towards other significant figures in our client's life outside of group. A member who challenges everything a leader says may have wide-ranging trust and relational issues with authority figures or intimate partners, and this may carry across many settings and many periods of this person's life. Similarly, the member who sees the leader as omniscient may fail to kind of rely on their own intelligence and instincts and be more dependent and naive than necessary in the various venues of their lives. Transference reactions are usually resistant to quick change or correction, as they've developed and been reinforced over many years. They serve to provide an expedient means of interpreting, although inaccurately, any and every new social encounter, thus rendering the unknown familiar and more comfortable. The brain likes to work as quickly as possible, kind of modifying complex situations into pre-existing patterns. It likes a path of least resistance. Modifying transference reactions is a long process of working through, and rarely does cognitively explaining or confronting rapidly resolve the long-standing interpersonal patterns. The multi-person arena, where members' views and beliefs and interpersonal stances can be validated or challenged, is one of group therapy's most unique and powerful strengths. Effective exploration of transference reactions towards leadership in the group depends upon the therapist's capacity to accept and experience all varied and divergent feelings and reactions towards them. Avoid defensiveness. This means not taking projections personally. To create a culture of exploration and curiosity, and be able to kind of maintain an accurate self-awareness to lead a discussion of contrasting perceptions of the leader without having a bias towards people seeing ones accurately or inaccurately. Transference can be gradually modified as members offer contrasting views of the leader, or if the leader's behavior disconfirms some kind of deeply ingrained perception or expectation that members bring with them to group. For example, clients begin to recognize that the leader is neither sadistic nor attacking, may come to the realization that others in their lives, partners, bosses, may actually care for them and are trying to be supported, and that sometimes their views of the intentions of others may be misread in a way that's not helpful and disruptive to their relationships. Many group leaders prefer to take on the work of analyzing transferences initially directed towards the leader, towards themselves, before encouraging members to engage in this stimulating, challenging work with each other. This leader-member dyadic work of working through transference can be a kind of a model for containment, curiosity, reflection, reality testing, that can serve as a model as group members begin to endeavor in kind of working through their projections towards each other. Now, I think it's important to note, as we talked about in relational psychotherapy, that when people's views of each other and views of the leader in group can be a combination of transference, but also of reality. So I think by being a member of a group, working with who you are throughout your life, soliciting feedback, you're kind of better able to get a sense and tease apart what's a transferential kind of communication and what might be more someone accurately projecting what's actually going on. Often group members may say to me, "Francis, you're really hard to read. You make weird faces when I talk." I think this is true. This could have an element of transference in it, but I think it's true. As I listen, I move my eyebrows, I kind of bite my lip in certain ways. As I think, I might kind of look up into the sky to kind of collect some kind of idea that I think's hiding in my cerebral cortex. So I would take this potentially as both, and maybe ask them for the impact of this, kind of going back to working on alliance with them. I think at this point in my career, it's something I work to do less of, but it seemed like a pretty deeply ingrained procedural process, behavioral pattern of listening that I have. So let's stop there with this transference ideas and transference towards the leader, and then kind of let's move into transference towards members and transference towards the group as a whole.